The first wave of COVID-19 pandemic hit Uganda in March 2020, and up to date, over 3,000 people have lost their lives, majority of whom being the elderly.
If you analyze, you find that older persons are being affected more than other age groups, and this is likely to reduce the number. Already in Uganda, the percentage of older persons is low compared to other age groups because we have a young population. So when we look at COVID-19 coming in at this time, it's likely to wipe out, it may not wipe out, but it's likely to reduce the number of older persons.
Uganda has an estimated 1.5 million old persons, and one is right to describe the elderly population as a group that has been hit hardest by the COVID-19 pandemic because it has in one way or another increased their vulnerability.
When we talk about Tonsemberera, don't move close to me. These ones have grandchildren who jump on them wherever they are. They sleep on the same mattress, but through sensitization now, they are separating the children. They even tell children, wash your hands before you come to me. And also putting on masks. Some of them could not have. We have provided masks. We have even sensitized the task force to give older people, to have special consideration for older when they are dealing with, when they are, in the COVID response, when they are dealing with older people and persons with disability.
In Africa, in Uganda in particular, the elderly people depend on their relatives, especially grandchildren, for financial and social support, but most of these young people have either lost lives or jobs due to COVID-19. The elderly people living especially in rural areas have had their lives put at stake since the would-be breadwinners have either died or become helpless. In 2010, Ugandan government introduced the Social Assistance Grant for Empowerment (SAGE) under Expanding Social Protection (ESP) program, where older persons above the age of 65 are supported with 25,000 shillings monthly. Though this program has continued even during the COVID-19 period, many older persons who have not reached 65 years have been left out. To complement the efforts of government, non-government organizations like Uganda Reach the Aged Association with support from development partners implement projects geared at helping the elderly population. One of such projects is the Inclusive COVID-19 Response to Old Persons project that focuses on COVID-19 preventive measures like hygiene and sanitation, plus information risk communication messages.
To complement the government services and interventions on prevention of COVID-19 spread among older persons and the children under their care. We have done this through enhancing awareness and sensitization on prevention of COVID-19 because most of the messages that were going across were not age-friendly. In most cases, they were written in English. In most cases, they were in smaller fonts that cannot be easily read by the older persons that have eye defects. So we have worked with our partners to ensure that we have age-friendly messages. We have used communication channels that are accessible to older persons. For example, using the community support systems and the peer educators and peer counselors in the society and in the communities where they stay to ensure that they deliver these messages to the older persons.
Another organization that has come on board is Brac Uganda, that has trained young people to identify people with psychosocial challenges in their communities, including the elderly. And this is important because old people often do not know where to seek support in case they face depression and anxiety due to challenges brought about by COVID-19.
So we realize that because of COVID, there have been so many challenges arising, mental health challenges, psychosocial challenges arising because of the effects of COVID. So we thought it would be a good opportunity to use these students that we have been supporting at different levels to train them in mental health and psychosocial support to be able to support their colleagues at school level, their colleagues, their relatives, and even community members to deal with the effects of COVID-19 that have culminated from the different restrictions and demands as a result of the disease. So the intention of this training is to ensure that they are empowered with the knowledge, with the skills.
And we're having a mental health training, and it's also having components of psychosocial support. And this training is going to help us, the alumni of the MasterCard Foundation at Brac Uganda, be able to be change makers within our community. In such a way, when we go to our communities, we interact with people and be able to, if these people are facing with psychosocial stressors, we'll be able to interact with them and give support, psychosocial support to them, such that those stressors they're having won't progress to become mental health disorders.
In a nutshell, apart from the social assistance grant for empowerment, SAGE, government needs to design other strategies to reach out to the elderly population during this COVID-19 era. For UBC News, I am Juliet Naiga and Sarah Natolo.